up until 71 years old, and I've just been over a lot of hernia problems. It all started quite some time back when I started getting a lot of acidity, and I went to a gastroenterologist who gave me some lactic acid tablets and some other medication, which was a temporary relief. One day, sitting at home, I suddenly got an acute pain in my stomach, and I was holding on to my stomach for almost 2 hours, not able to budge from where I was sitting.
It was a very traumatic experience for me when she started feeling unwell, complained about stomach aches. They got so bad that I decided to take her to Max, where by chance I met Dr. Vashisht, and he took everything over.
She came in midnight of 2019, and she had perforation peritonitis. And when we talk about perforation peritonitis, she had a Spigelian hernia, and Spigelian hernia is a pathology where the intestine or the bowel can go between the muscles, and it's a very small defect.
First time I met Dr. Vashisht was after my first surgery, because as you know that I went into the emergency and I wasn't aware of what was happening. And even in that befuddled state, I didn't catch on to his name, but somehow his presence was very soothing.
When we got a CT scan, so we found multiple hernias in her in her central abdomen, her ileostomy site, where this was coming up, and definitely some few more hernias in the abdominal wall. So it was a thing what we have to tackle, and there was a gallstone also she had. So we have to tackle three problems: multiple hernias, reverse the intestine so she can pass stool from the normal passage, and remove the gallbladder. So this was a big surgery. We thought it was going to last 4 to 6 hours. So we prepared for a month in terms of chest, cardiac and all, nutritional wise. But then we admitted her.
It was as if the colostomy bag had taken over my life. I was determined to get it out of my system. Almost twice we had to keep getting the tests done to be on top of everything, so that whenever there was a window available, I could go in for my second surgery.
So when we took her for the surgery, because of the past surgery, what anyone does, and if any past surgery is for an acute emergency, there are a lot of adhesions. So we opened up, did a lot of adhesiolysis, reversed this thing, removed the gallbladder with the stone, and then started doing an abdominal wall reconstructions.
After the surgery, she's now perfectly normal now.
Dr. Ashish Vishisht, ever since we've come to know him, has been very helpful and very cooperative in answering questions.
Oh, Dr. Vashisht was superb. I mean, he was so good that we become more family now. She was looked after by the Max people very well.